Welcome to this COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Mr. Noble Maungwa is with me on the sign language desk. This week I received a number of concerns and questions on the availability of COVID-19 vaccine doses in the country. Some went on to assume that the country had run out of vaccines, which is not the case. In addition to these concerns, some also wanted to know what additional measures government had put in place to help prevent a potential third wave. This in view of the effect that the feared and more transmissible Delta B.1.617.2 variant that was first identified in India was also identified following additional analysis of samples from Kwekwe this week. My update today is therefore going to focus on these two important issues, but first, let's quickly look at a few key COVID-19 national statistics. As of Wednesday, 9 June 2021, Zimbabwe's cumulative number of COVID-19 cases was over 39,432. About 893 of these are active cases. Most of them are mild and isolating at home. In other words, over 94% of all reported cases since the pandemic started here in Zimbabwe have recovered. Of concern, however, is the recent increase in the 7-day rolling average for new cases. This has mainly been associated with some outbreaks in a number of learning institutions. These outbreaks are being brought under control by the Ministry of Health and Childcare in collaboration with the ministries responsible for learning institutions, our two ministries. Specifically, a lot of effort has gone into contact tracing, mass testing in the communities around these learning institutions for early case detection and hence early quarantine and isolation of identified contacts and positive cases, respectively. Our laboratory scientists have gone a step further by conducting genomic sequencing of samples from outbreak areas in an effort to detect any new and more transmissible variants, such as the Delta B.1.617.2, detecting it early in order to prevent the spread of these variants and hence also prevent a potential third wave. In addition also to these measures, government this week published Statutory Instrument 154A of 2021, in which all those traveling from India or anyone transiting through India will be tested for COVID-19 on entry, even if they present a COVID-19 free certificate. These individuals, if found to be negative or positive for COVID-19, will be directed to quarantine or isolate in a designated facility or facilities, respectively, at their own expense or cost. Let me now turn to the National Vaccine Program. It is good to first remind ourselves that at the very beginning of the vaccine rollout, government in a post-cabinet briefing of 9 February 2021 announced a very clear national vaccine deployment policy direction, specifically indicating that first, the intention was to reach 60% or over of the population. The choice of vaccine would be science-based with adequate research findings guiding decision-making. Priority would be health workers, elderly, and other vulnerable groups. And finally, the vaccines would be free and will be administered on a voluntary basis. The statement also indicated that vaccines would be sourced from multiple manufacturers through multiple financing arrangements as long as science was followed. In line with this policy direction, very clear policy direction, the National Vaccine Program has made lots of progress. Implementation is guided by a detailed deployment plan that has been widely shared. By the end of Thursday, 10 June 2021, just over 1 million vaccine doses had been administered out of the total of over 1,735,000 doses that we procured or were donated and all had been received. The recent vaccine access concerns raised by the public are taken very seriously. Government is making all efforts to avail additional vaccines for everyone. Early this week, government received additional vaccine doses. A total of 25,000 doses of Sputnik V, Sputnik 5 vaccine were received from Russia on Wednesday this week. The global demand for vaccines has really increased so much. And so more and more countries have embraced the need to vaccinate their population. This is why that increase has come about. Supplies for vaccines are therefore going to be limited, resulting in potential delays in vaccine delivery to various countries. To address this challenge, the Ministry of Health and Child Care is redistributing vaccine doses and reprioritizing administration of available vaccines to ensure that those who get their first dose, especially those in the high-risk category, such as the frontline workers, get their second dose first. This, however, does not mean that the rest of the people or population will not get their doses. They will. Let me take this opportunity to inform you that globally, Zimbabwe is among the top countries moving fast with vaccine rollout. The country is ranked among the top countries in terms of vaccine universal access to its people and is leading on the Africa continent in terms of the total number of individuals that have been fully vaccinated, and it is demonstrated on the Our World in Data global maps that are published daily and specifically this week. Finally, Zimbabwe has made a lot of progress in the fight against COVID-19 in general. The national recovery rate is good at 94%, as indicated early. Most identified cases are mild and isolating at home. The country response, like any other response, however, any other response in other countries in the world, also faces some challenges. This is expected. This, however, should not lead us into panic or complacency. It should instead push us to buckle up and remain resolute. We are on the right track. Remember, it is what we do as individuals to protect ourselves that makes or matters the most. So do get vaccinated, social distance, wash your hands, and yes, mask up properly. Thank you.